We talk about people's freedoms and their right under the Constitution to have autonomy and control, but we're still divided on the issue of euthanasia and other forms of end-of-life care. And to explore palliative care and to better educate society, I'm joined by Dr. Penelope Mathe, who is a palliative care social worker. Dr. Mathe, good morning. Thank you for spending some of your holiday with us today.
Thank you so much, Iman. I'm very excited to be here, to be talking about palliative care, the importance thereof, and also, discussing this issue of euthanasia. Thank you so much.
You're more than welcome. There's often confusion or conflation between the concept of end-of-life care, palliative care, and euthanasia. So I think it might be nice for us to just share with our viewers and explain what we're talking about.
Okay. The difference between euthanasia and palliative care, euthanasia is assisted dying. And palliative care is an approach that is used to assist people who are living with life-limiting illnesses. It's a holistic care. It's about pain management, symptom control, so that they don't suffer with pain, so that they don't struggle with pain. When I say it's a holistic care, it means it's not only the medical doctor that is there. We have your social workers, the spiritual counselors, the nurses, the home care carers, we have the dietitians. It should be the whole team so that we can be able to take care of a person holistically.
Let's just go back to that, because we'll get into the laws, we'll get into the moral and ethical dilemma I think we face as a society, and especially here in South Africa as a country, over the right for people to choose when they've had enough of living. Talk to us about some of the challenges and I think the psychological impact and trauma related to getting a life-threatening diagnosis. You might be told you've got stage 4 cancer and that it might be terminal, or any other diseases. What happens in a human being? What are the range of things that you're trying to solve for and medicate or deal with through palliative care?
It is not only a physical pain, it is a psychological pain, it's a social pain, it's a spiritual pain. That's why I said previously you need all the team members to be there, because people tend to look at the physical pain, that's okay, the medication needs to be done, medical procedures need to be done. They forget that a person is a whole. We need social workers to be there, we need psychologists to be there to deal with the psychosocial aspect of being diagnosed with a life-limiting illness.
So euthanasia, as you explained to us in the beginning, is the ability to die while being assisted.
Yes.
It's a controversial topic, and we certainly know that it's divided society along moral lines. But talk to us about, at the end of this palliative care cycle, when you've tried to help someone psychologically, even spiritually, if they're religious, try to help them in terms of their medical and pain management journey. If somebody arrives at a point where they don't see the prospect of being comfortable, they're in a lot of suffering, a lot of agony, what happens typically right now in South African society when you're dealing with a patient like that?
We continue, if the person is under palliative care, we continue providing palliative care, because we don't, South African Constitution does not allow assisted suicide, and we also, as palliative care providers, we don't support euthanasia. So we ensure that the person is managed, but the pain is managed, like I said, every aspect. There is no beyond that. So we just need to ensure that we have the high quality palliative care so that the person does not struggle with pain. Because like I hear you say, people, this pain, they don't know what to do or where to go from there. So yeah, high quality palliative care, that's what we say will help for now.
Yeah. Isn't it quite expensive? Because you're talking about, as you say, so many medical professionals, social workers working together, then you're providing the medicine, and sometimes this care is happening in a hospice or in another facility. How expensive does it become to administer palliative care?
Iman, it is very expensive. In such an extent that people who do not afford the palliative care in your private hospital, they suffer a lot. People who are not employed, people who are relying on the social grants, it becomes a burden to them. It becomes, a challenge for them. And also with the closing of most of the hospices around South Africa, we find people who are poor suffering to get this medical care, this palliative care. You know what? Our government is trying, but at a very slow rate, to implement it to the hospitals, to make it accessible to people. And there's still a lot to be done in terms of also creating awareness around palliative care. Many people come across the word palliative care when they are diagnosed with this life-limiting illness and they are being told there's nothing that we can do for you anymore. Now you need to go for palliative care. So, okay, it's a struggle.
Yeah, we'll come back. I want to pick up this discussion. I think it's a really, really important one and potentially affecting people who are watching us today. So we'll continue to talk about this with Dr. Penelope Mathe. Do stay with us. Let's continue our conversation with Dr. Penelope Mathe, a palliative care social practitioner as well. So we were talking about palliative care in South Africa, how important it is, and this is the threshold to which South African medical health practitioners can go and no further, legally speaking. How many people have access to this important end-of-life care?
I will say few people have access to it, and because of the lack of awareness, there's no awareness out there in the communities. So if you can visit our public hospitals and see people there in the wards, and as also a social worker, when I visit them, some of them, when I talk to the staff in those hospitals, I could tell that this person can benefit from palliative care. But because, it's not pushed forward as it's supposed to be pushed forward, people are not getting access to palliative care. That
just sounds horrific, because it means so many people are living and they're suffering not only physically, but they're also suffering psychologically and mentally. And in a number of cases, we see people don't have extended family or people to take care of them, or people are working. So it's just horrific to kind of imagine their lived experiences. But Dr. Mathe, here's the thing. People, all of us, right, we make decisions about many things throughout our life, including about our health. But when we are terminally ill, when we are sick and when we are suffering, we're losing our dignity, right? Sometimes people lose bowel control, or they can't keep food down, or they become emaciated. They are not allowed to decide when they want to die. Should they not have that choice?
People should be allowed autonomy. If the government can work towards legalizing euthanasia, we always say people dignity, allowing people autonomy. But like you say, when they get there, it stops right there. So, yeah, people need to be able to decide. But for now, the decision that they can only make when it comes to end-of-life care is to where do I want to die? Not when. Where do I want to die? Who is supposed to be near to me? Do I want any artificial feeding or all of those things? But when, you cannot say when to die. It's with who and where you are going to die. Those are the only decisions I feel people can make.
I mean, I've told my children that if I'm really suffering, I would love for someone to put me out of my misery, out of my suffering. We know that in places like Canada, Belgium, and some US states, assisted dying is legalized. When you look at first of all, the universe of palliative care in South Africa, which is very limited, and then you look at the threshold, in other words, people have to just stay in that loop. What can you share with us around what people are telling you in that moment of suffering? Do they ask to be I hate to use this term because we use it for animals, but to be allowed to just die in peace and to end the misery and the suffering.
As a social worker, I'm often called by our home care nurses to the patients who will be saying, can't you please help me? And obviously, we will say no. We get that
When they say
a lot.
Please help me, take me deeper into that.
Assist me to die. I cannot take this anymore. I no longer have a good quality of life. I don't want to continue suffering. And also, we do get the family members who will say, can you please, because, you know, they don't understand what palliative care is. They will say, there was one of my neighbors and your team came and the person died. Can you please also help my mother? We see she's suffering. She needs to go. We don't want to see her like this. Kindly assist, kindly give something. Then we will have to educate to say, no, we don't do that. In fact, this is what we do. And many people, some of them, they become disappointed to say, oh, we thought you are going to give. Can I just mention, morphine is known worldwide. People who don't know about morphine, they will say, we thought when you come, you're going to give morphine and the person will die the same day. And then we will be educating to say, no, this is not what is happening. Going back to your question, yes, we do get the people who say, aren't you here to assist me to end it all? And the family members will say, I don't want to see my father, my child, or my mother suffering like that. Can you please assist us?
Yeah.
It goes back to educating them to say, we don't do this. Yeah.
I mean, some of the ethical and moral dilemmas are related to, we think about medical practitioners. The oath that they take is to preserve life and dignity and not to cause death. From a religious perspective, people will say only God has the power of life and death. So all of this is in the mix. And then, of course, you have other predatorial themes, like people who might have other motives for wanting someone to pass in a compromised state. So there's a lot intertwined there. But thank you for sharing with us the role of palliative care in making people comfortable, not only physically, but also emotionally and psychologically, to deal with this impending end of their lives, and really applaud the work that you and people like you do. It can't be easy to watch people suffer and watch people approach the possibility of dying. So Dr. Penelope Mathe, thank you very much for your time this morning.